Dr. Gomez, I would like you to explain to us why does a root canal need a crown? Some patients, they have no crown and their tooth lives pretty long. It doesn't break, but apparently that's not advisable. Can you tell us a little bit about that whole stuff? Root canals and crowns.
Yes, when a tooth has a root canal, and we remove the nerve of the tooth, we remove the growth supply of the tooth, so the tooth becomes brittle and can fracture very easy. So by doing a crown, you're protecting the tooth from fracturing and then you're saving the tooth. If you don't do it, you might not be cautious enough to avoid biting on the tooth, and eventually you're going to fracture the tooth, and if you fracture in a way that it cannot be saved, then that tooth is going to be lost, and you lost all your investment if you had spent, any amount of money on saving the tooth with the root canal, and now you broke it. You have to extract the tooth and you lost it. So, and when you place a crown, you're protecting the tooth from fracturing.
I see. So, so that the reason, you mentioned the reason that once you do a root canal and you basically take out the nerve, that means the blood flow, whatever flows through a tooth to whatever degree is stopped, and the tooth gets more brittle, right?
Exactly.
So that's why it breaks easier. And on top of it, I guess, it also has a big hole on it. So, a big stick becomes all of a sudden a pipe. And
Right, because when we do the root canal, we go in the center of the tooth where the nerve is. So you have maybe a big cavity on one side, and now we're making a hole through the tooth to get to the nerve, and now you have like a shallow tooth that is nothing in between. You're going to have a shallow tooth, and in the center you're going to have a filling. But that's not going to be strong enough to support the biting and the chewing. And if you bite something very hard and you forget about it, you bite something too hard, then that tooth can break. And once it breaks, if it breaks in a way that it can be restored, that's okay. But sometimes that's not the case. Most of the time, the tooth fracture along the way the fracture goes to the root side, and that's it. That's the end of it. And then you have to extract the tooth, and you lost whatever was done before, and all the expenses that you made trying to save the tooth is lost because the crown was not made at the right time.
Right, and on top of it, if and when that tooth fractures, as you just mentioned, it not that any fracture is good, but it might literally fracture, below the gum line. Basically, it might be very difficult to extract. I have heard. Have you experienced that?
Once it's below the gum line, it's difficult to restore because you need to have a margin to fit a crown beyond the gum line. So any fracture that goes beyond the gum line is very difficult to restore. Sometimes it's impossible, and you have to pull out the tooth. And by doing the crown, as soon as you have the root canal finished, will prevent that from happening, and you protected the tooth.
Interesting. So basically what you're saying is a person who didn't have a crown yet had a root canal, and it didn't break yet, most in the case, he was lucky, and he better gets his butt to a dentist and puts a crown on it, because that luck might run out.
Exactly.
It's like with me and speeding tickets. Just because I didn't get caught today speeding doesn't mean I will not. And most likely, odds are that I will get one, and I know I do frequently. Thanks a lot, Dr. Gomez. Bye-bye.
You're very welcome.